Hi, this is Nasreen Afza, Department of Psychology, Teresian College, Mysore. Today's topic is cognitive behavior therapy. Let us look at the main features of cognitive behavior therapy. Cognitive behavior therapy is a psychosocial intervention that aims to improve mental health. Cognitive behavior therapy stems from both cognitive psychology and behaviorism. It rests on the idea that cognitive processes, that is, thoughts, influence emotions and behavior. It focuses on challenging and changing unhelpful cognitive thoughts, improving emotional regulation, and development of personal coping strategies. It benefits numerous conditions such as depressive disorders, eating disorders, OCD, and many more. Cognitive behavior therapy is a well-established, highly effective and lasting treatment used to treat a wide range of issues in person's life, from relationship problems or difficulty sleeping to anxiety, depression or substance abuse. Cognitive behavior therapy is a collaborative, short-term and goal-oriented psychotherapy that offers a hands-on approach to problem solving. Let us now understand the different forms of cognitive behavioral therapies. The two important forms of cognitive behavioral therapies are as follows: Albert Ellis's rational emotive behavior therapy and Beck's cognitive therapy. They are similar, but there are slight variations, and both are popular. Let us first take up Ellis's rational emotive behavior therapy. Rational emotive behavior therapy is the first form of behaviorally oriented cognitive therapy developed by Albert Ellis. It attempts to change a client's maladaptive thoughts on which emotional responses and behavior depend. So the main idea is that the irrational beliefs or thoughts can lead to a lot of emotional problems. The main focus is on restructuring on individuals' belief system and self-evaluations, especially the irrational shoulds and oughts that prevent individual from having a more positive sense of self and a fulfilling life. Coming to the stages in rational emotive behavior therapy, the ABC framework is central to REBT. So A is the event or the adversity. It could be any fact or any activating event. B is the belief of the individual regarding that particular event or adversity. So whatever, how he perceives and what he believes about the event goes there. C is the emotional and behavioral consequences. So whenever there is a belief system, especially when there is a negative belief, automatically there is an emotional consequence. The person may feel tense, the person may feel bad. There are so many emotional aspects attached to it. So that becomes the third aspect. And D is to dispute a person's false belief through rational confrontations. So generally, people try to dispute these beliefs by false and rational confrontations, by elaborating on such thoughts, and this leads to E, that is use of behavioral techniques to encourage clients to have new experiences and to break negative chains of behavior. So this is where the techniques are employed and the belief system which is analyzed is then corrected, is changed. So finally, it aims to increase an individual's feeling of self-worth and clear the way for self-actualization, similar to the humanistic approach. Now let us go through the techniques used in REBT. The three important techniques that are employed are problem-solving techniques, cognitive restructuring techniques, coping techniques. So let us first see the problem-solving techniques. These include problem-solving skills, assertive skills, social skills, decision-making skills, conflict resolution skills. So all these techniques need not be employed. Whatever is needed for a particular client, those techniques or those skills are taught, those skills are taken care of in this aspect. Coming to the cognitive restructuring techniques, we have logical and rationalizing technique, guided imagery and visualization, using humor and irony, exposing yourself to whatever you fear, disputing irrational beliefs. These are the techniques that are used under cognitive restructuring depending on the client, and whatever needs to be changed is applied. Coming to the coping techniques, we have relaxation, hypnosis, meditation, breathing exercises. So from these techniques, whatever is necessary is picked and applied. Now let us move on to Beck's cognitive therapy. Beck's cognitive therapy was originally developed for the treatment of depression. Later, it included anxiety disorders, and now it is used for a broad range of conditions like eating disorders, personality disorders, substance abuse disorders, and schizophrenia. So Beck talks about self-fulfilling prophecy or problem cycle. So the first thing is the problem or a mistake. This is the first thing that leads to a strong negative belief. So depending on our perceptions about the particular problem or mistake, we have strong negative beliefs about it. This in turn leads to adverse effects on mood. So whenever there is a negative feeling, obviously it leads to negative mood. It could be anxiety, it could be sadness, which in turn leads to avoiding activities. So any activity that resembles or that is similar to that problem or the mistake is avoided. And this leads to the strong negative belief again, because when you avoid situations, you confirm the negative belief, and this cycle goes on in this way. So again, there is a strong negative belief because you are avoiding the stressful situations, you are running away from problems, which in turn leads to stronger negative beliefs, and again it has its effect on mood. So this cycle goes on. Coming to the stages in Beck's cognitive therapy, clients are made aware of the connection between their patterns of thinking and their emotional responses. They are taught to identify and keep record of their thoughts and their emotional reactions. With the help of the therapist, they identify logical errors in their thinking. The approach varies from one disorder to another. For example, in panic disorder, the focus is on Firstly, identifying the thoughts about the feared bodily sensations, because in panic disorders it is the panic attack and the sensations that one experiences during the attack which triggers to various problems. Secondly, teaching the client to decatastrophize the experience of panic. So, evaluating cognitive behavior therapies, REBT is a very much alive. It's most helpful in helping people to cope better with everyday stress. And Beck's cognitive therapy is extremely beneficial in elevating many disorders such as depression, substance abuse, especially with regard to prevention of relapse, panic disorder, and anxiety disorder. These are the references. I request all of you to subscribe to this YouTube channel. Thank you.